Hi, I'm Steve Clemons, and I have a question. What will it take to get the United States back online and back to normal? Let's get to the bottom line. Americans, just like everyone else around the world, are wondering about the months ahead. Should we let our kids go back to school face to face? What are the risks? How many more will lose their jobs, or worse, their lives? Will the stock market crash? Are most folks going to go back to their offices or their businesses or their colleges? In other words, will life go back to normal anytime soon? And what will the quote unquote new normal even be? Meanwhile, American states have been left to their own devices to deal with this virus in the absence of any coherent national policy or guidance. Some states were spared a major outbreak, and others have waffled between crippling shutdowns on one hand and flamboyant disregard for this threat on the other. So is there a key to getting all of us, all 8 billion of us around the world, out of this crisis? And if so, what is it? My guest today has spent his life studying human progress, the power of ideas as change agents. Professor Paul Romer won the Nobel Prize in economics in 2018, and he was the former chief economist of the World Bank. He was part of a major Rockefeller Foundation report just released titled A National Testing and Tracing Action Plan. He joins us today from his home in Connecticut. Paul, thank you so much for joining us. As I mentioned, the Rockefeller Foundation just issued a report about testing and contact tracing. And really, the bottom line of that report is if we don't get those elements right, American society does not return to normal. You participated in the release. What is the deeper message here?
Yeah, I was pleased to work on this report, especially with Raj Shah, the president of the Rockefeller Foundation, because Raj is willing to just speak bluntly and write bluntly and convey the messages that have to be heard. The overwhelming message that came out in an earlier Rockefeller report and is reiterated here is that you cannot have a recovery of the economy until we contain this virus. So that's just like undeniable at this point. Then we have to ask, well, does contain mean eliminate? No, I think everybody recognizes this virus is going to be out there indefinitely. At some point, there will be a vaccine that most people can take that will protect most people from the virus. And that will mean that it's contained at a very low level with little disruption in our lives. But there's this crucial gap that could be 2 months, 4 months, 6 months, 12 months, 18 months, maybe 5 years before we actually have a vaccine that works. And what the Rockefeller report does is say, in the United States, which is a country where the virus is now very widely distributed, what strategies do we have available to contain it until we get a vaccine? And the answer is, in a way, it's very simple. There's about, 1.5% of the US population that might be infected with this virus right now. If we just knew who those people were, we put them in isolation for a couple weeks, then we'd stop the spread of the pandemic and we'd have very low levels going forward. So the failure in the United States has been to grapple with the importance of putting in place the tests and the contact tracing, which can help us focus and use tests more effectively, but put in place those two essentials for finding the few people who are infectious and putting some restrictions for just 2 weeks on them. If we do that, then we don't have to put restrictions on everybody, which is what's doing so much damage to the economy.
What do you think has gone wrong in this crisis that we have failed so miserably to deal with it?
Yep. So there's a sign you see in railroad crossings in France, which says, careful, one train may hide another. I think we need to look for a couple things going on here. One is, I think, a failure of leadership by the executive branch in the United States. I don't have a lot to add to that. And it's, of course, a very partisan debate. So it's hard to separate what are the facts versus what are the partisan positions. What troubles me is this other train. I think what we're facing is an academic discipline that got arrogant and therefore got very rigid and preachy about what we need to do in the face of a pandemic. This academic discipline of public health lost its ability to recognize when the evidence is suggesting something else is going on, and making a change, finding another policy if one isn't working. There are two things that have changed that the academics, I think, have been slow to recognize. One was that this is a virus which has a lot of transmission before people have symptoms. That was not the case in SARS and MERS, but this means that contact tracing is much harder to carry out because you use symptoms as one of the triggers to know who to go interview, how to go track down their contacts. So contact tracing isn't going to work as well. The second problem is that more of the transmission from this virus takes place through aerosols rather than small droplets. So the droplets, which are larger, I should say large droplets compared to these very tiny aerosols. The large droplets tend to fall to the ground so that if you're the famous 2 meters away, then you will not be exposed to those droplets. But aerosols can float in the air for hours, and in a poorly ventilated space can expose people who are far distant from the person who's generating these aerosols. So the contact tracing strategy, we knew very early on this would not work as well. The 6 foot distance rule did not work very well. And to be honest, if we go back in March, I remember I first learned about the importance of wearing a mask from the head of the CDC, but it was the head of the CDC from China. There was an interview where he was asked, what's the United States doing wrong in March? He said, the biggest mistake is you're not wearing masks. It took our CDC and our public health community a long time to come around and just pay attention to what had been learned in other places, that with this kind of transmission via the aerosols, masks are very important because they stop somebody from spreading, not so much because they protect somebody from inhaling. So on all of these dimensions, not too much insistence over and over again on contact tracing, too much insistence on the distancing, too slow to emphasize masks, and then finally, too hesitant to think about other things we could do differently. And the thing that we could obviously do differently is that we've gotten brand new technologies that make tests much cheaper, potentially much more widely available, very accurate. We should have just scaled up our use of tests. And I've been saying this since March. Scale up your use of tests, whether or not you've got a contact kind of chain to follow. Test a lot of people you think might be infectious. As soon as you find somebody who's infectious, get them into isolation. And if you get enough of the infectious people into isolation, you get yourself on a path where of exponential decay, and this pandemic goes into this kind of low-level sustainable mode. And on all of these dimensions, I think the academics and the officials listening to those academics were too slow to update based on evidence that things weren't working.
So as you think about that test, the $75 billion that Rockefeller Foundation report says, how do you feel this could be transformative for this nation and maybe other nations?
Yeah. Well, let me kind of come back to the earlier part of your question, because there's a story there that's interesting. You know, I said that the traditional contact tracing wouldn't work. Part of the early analysis to offer some hope said, well, there's this other idea of digital contact tracing, where you have cell phone apps and we can use that to more quickly trace the contacts. And maybe that will, and you know, the early calculations suggested that might work if a large fraction of the population has these apps installed on their phones, like more than 80% installed on their phones. Now, I spent some time, I downloaded one of those apps, I explored them, I thought about recommending this as a strategy. It very quickly became clear to me that it wasn't just a matter of could we write the code to make this work, because we could. The problem is that we had to persuade people in the United States who don't trust big tech, who don't trust the government, to use these apps, and we got to persuade everybody to get much effect out of them. And so I concluded and had a really kind of blunt and harsh battle with some of my colleagues who were, pushing this in ways I thought were actually misleading. I said, forget about digital contact tracing. We're kind of in triage mode. This is not going to work, because think about people who are following QAnon. Think about people who are following like the anti-vax movements. These people are not going to adopt your contact tracing app just because you say it's safe, even if it is kind of cryptographically safe. I mean, side note, it turns out that the things that are being proposed are not that safe. There's a lot of personal information that's being leaked. And that may actually have been intentional, frankly, by the companies that developed these things. But in any case, we had to be realistic about not just the technical solutions, but the human factors involved. What were people going to accept? And my conjecture is that if you made it easy enough, people would accept getting a test result. I mean, most people want to know, am I going to infect my kids? Am I going to infect the people I know at work? And I also felt like some Scandinavian colleagues persuaded me of this. If we just got test results in the hands of people who could self-isolate, that would make a huge difference. We don't have to worry about, can we be sure that those test results get to officials who will enforce isolation and confinement? The first order of business had to be, let's just get the information. Then we can figure out, do we need to pass it on to somebody else? Do we need to have a system of enforcement? And this is where I ran into this bottleneck with the people in public health, where they were just insistent that you should not test people who don't have symptoms. And this again was a kind of an approach that made sense when you didn't have much asymptomatic transmission, but it made no sense at all in the current context. And there are still well-known public health officials who are arguing we don't need tests. And think about what that says. In effect, they're saying we don't need tests because we've got this other solution, which is going to work in ways that are cheaper than building out the tests. Well, I mean, where have we gotten with all of those other solutions? We got, like more than 100,000 people have died. We've got an economy where we're going to lose like $7-8 trillion worth of output, the best guess right now, and nothing is working. So this idea that, well, we're going to do all the things we always do because they work, we don't have to try something new. I think at this point we really got to admit those other things are not working, and we better try something new.
Well, I'm so happy you raised testing and this kind of civil war going on about testing and where all of that is. The president's Homeland Security advisor, the former Homeland Security advisor, Tom Bossert, was actually saying exactly that. We need to test not the ill, but the well to understand and get our heads around this. So it's not necessarily a partisan divide. But let me play for a moment a clip of the president of the United States talking about testing.
We test more than anybody by far. And when you test, you create cases. So we've created cases. I can tell you some countries, they test when somebody walks into a hospital sick or walks into maybe a doctor's office, but usually a hospital. That's the testing they do, so they don't have cases, whereas we do. We have all of these cases, so, it's a double-edged sword.
Now, Paul, I could have run a clip from Mitch McConnell wearing a mask, talking about the importance of wearing masks, or Dr. Anthony Fauci or Dr. Redfield, the head of the CDC in the United States, who did not encourage wearing masks as soon as China did, as you just noted. But it raises these interesting challenges that testing is this malleable thing. Some think it's good, some others don't. You guys are putting a rock solid marker down and saying we have to have it.
Yep. Well, let me just comment about the president's clip. After his interview with Chris Wallace, where he again claimed that the U.S. had the lowest mortality rates in the world, I tried to look at what I think is the relevant mortality rate, which is per day right now. Where does the U.S. stand compared to other European countries? And we have the highest mortality rate compared to any of these countries. It's higher than France, Germany, it's higher than Sweden, it's higher than the United Kingdom, it's way higher than Canada. So, and if you kind of followed the back and forth about that interview, it seemed clear that the president actually believed that we had the lowest mortality rate when he said that. He was looking for the evidence to back it up. So the question is, how do you get the message across to somebody who's picking up and retaining things that aren't true. Now, with masks, that has finally worked. The voices were unanimous, persistent, and eventually got him to recommend wearing masks. The problem on testing is that there is this dissident faction, this rear guard in the public health community, which is still resisting testing. And so that's enough to, I think, let this kind of obstinate, kind of hold on things that are just misguided persist. So I felt like I've been running a kind of a two-front war where I'm trying to get the public health community to just recognize it may not have been a good idea to use a lot of tests 20 years ago or with other vaccines, other viruses, but with this one, we really need to do it. And so it's against the academics and the public health officials, and then with the public and people like the president, who I think are just still confused about this. Let me try and explain one thing that I think was very important about this report. We gave a name to something that didn't really have a name before: screening tests. Now, the test itself is the same, but there are different ways to use it. You can have a diagnostic test where a doctor's trying to figure out for a single patient, is this person sick? What should I do in terms of care of this patient? There's also something called surveillance tests, where you go out and you test a random sample of the population to just know, on average, in this place or at this time, how many people are infected. What we're pushing is neither diagnostic testing nor surveillance testing, but what we're calling screening tests, screening testing. The idea is you screen a large fraction of the population, you find the small percentage who are infected, and then you actually have them repeat. If they're positive, you have them repeat with a clinical diagnostic test. So they're counseled by a doctor, you're sure that they're positive, and then you get them into isolation so they don't infect anybody else. But until we had a name for it, many people were confused about clinical diagnostic tests. Well, we can't give a clinical diagnostic test to everybody, and you don't give a clinical diagnostic test to people who are, we have no indication that they're sick. But the name locked people into a notion of how we would use it, and just giving a clear, simple name and repeating the basic point, which is that it's valuable to test people who don't have symptoms, because you're going to catch a few of the people without symptoms who are actively spreading this virus. Those two messages are the essential bits of communication we have to get across to people so they understand that widely available, widely used testing is the way to get into this condition that we want to be in, where the number of people who are infected is exponentially decreasing over time, and be sure we stay away from this terrifying region where the number who are infected is exponentially growing, which is where we've been for the last couple of weeks.
Simultaneously in the United States, we have a health crisis, a race crisis, and one of inclusion, and an economic crisis with the unemployed. And you're famous for saying that a crisis is a terrible thing to waste. It's tagged
Right
to you. What should we not waste in this moment of many storms?
Well, good for you for doing your homework and digging that phrase up. I've actually been trying to run away from that phrase right now because it's, in this crisis, I don't really want to be trumpeting.
I think it was made for this moment, Paul. I think that phrase was made only for this moment.
It's kind of your job to nail me down on that. So good on you. I do think there might be an opportunity to learn some of these basic lessons about it's very important for experts to communicate clearly and to recognize that they could be wrong and be ready to update when they're wrong. The world is a constantly changing place. Things that were right 10 years ago may not be right now. So, one of the very troubling things about this was that Johns Hopkins did a study and tried to predict which are the countries that are best prepared for a pandemic. They did this last fall. They predicted that number one in the world was the United States, number two was the United Kingdom. Both countries that have done a terrible job of responding. And I think it's not just a coincidence that they came in at the top and have done so badly. These are countries that have these very well-developed university departments of expertise in public health and epidemiology and virology. But what that meant is there was a little bit too much expert arrogance. And therefore, instead of the kind of trial and error approach that many other countries in the world use, let's try this. If it works, okay. If it didn't work, let's try this. Trial and error is often how you find a good solution. When I've talked about discovering new devices, new compounds, things like the transistor, trial and error is most of the time how we get to good things. So unfortunately, I think our strength in terms of theory and academics and expertise turned out to be a real weakness because it bred a certain kind of arrogance and a slowness in paying attention to evidence that didn't fit with our models and our theories. The other thing that I think is really quite troubling is that there was also a certain willingness to mislead. We're the experts, we know better, we're just going to mislead to get what we want. So when experts wanted the masks to be available for people in hospitals, they said masks don't help. Then, when we had more masks and it just became undeniable that masks would actually slow things down, it was like, oh yeah, well, no, we were wrong. Actually, masks do help. This was not just a case of new evidence coming in, because remember I said the Chinese were saying this back in March. There was a somewhat conscious willingness to just say things that weren't really justified based on the data to try and achieve a goal, which was at the time manage a shortage, make sure we could protect masks for the hospital workers. But it ends up being very damaging to the credibility of the experts. So I think, what we could come out of this crisis with is a serious humbling of the experts and a serious recommitment to some basic principles like humility, willingness to pay attention to the evidence, to listen to others, to explain patiently, to explain clearly, and never to mislead because you think in the short run it will be helpful. Because in the long run, it so damages our credibility that we just can't tolerate it. If we learn all of those lessons, we can get back to this situation where, as a species, we made enormous progress by taking advantage of scientific expertise. We need the experts to work hard at earning the position that they have and do a better job, and then we can get back to making sure that science is generating progress for everybody. There was this famous thing that Henry Kissinger said about about fights in the academic world. The fights are so vicious because the stakes are so small. For once, these are not small stakes.
Paul, the Rockefeller Foundation has put out what is really a playbook for what needs to happen. Do you have any sense of confidence that the guardrails in that will be adopted? Or do you think this is going to be a battle that we're going to be fighting, that you're going to be fighting for quite a long time yet, to get your recommendations on contact tracing and testing in place?
I'm actually somewhat optimistic, cautiously optimistic. The Republicans in the Senate right now are crafting a bill, which is a response to a bill that was passed by the House. The House bill had $75 billion for testing and contact tracing. The Republicans in the Senate, the last news reported, they're proposing $25 billion. The normal course would be there'd be some back and forth and they'll horse trade. I think they'll end up closer to the $75 billion. And that would really make a huge dent in the level of testing we need to have here in the United States. But also we could be developing better ways to do testing in the central labs. If we take some of that $75 billion, devote it to a crash program to get many more types of tests available in many more settings, and then to pay for the ongoing costs of administering those tests, I think in 4 months, we could be way ahead of where we are right now.
Well, Paul Romer, I really appreciate you spending time with us today.
It was my pleasure.
So what's the bottom line? It sounds like a simple idea. Just get testing right so we can get back to normal life pretty quickly. But even something that simple gets bogged down in politics and even terminology. As Paul Romer said, screening tests sound better to people than diagnostic tests. But beyond that, the divisive politics of today's America have made wearing a mask a political act, and that's much easier than testing. Every month that passes without getting our act together costs human lives and staggering multi-trillion-dollar economic losses. My guest today was optimistic, but I'm not. There's no indication that the next 3 months are going to be any better than the last 3 months. And that's the bottom line.